Well, as we get older, many of us suffer from arthritis. And here with some tips to ease the pain is Dr. Les Goodman. Thank you so much for joining us.
I appreciate the opportunity for allowing me to come to
We
speak with you.
appreciate you coming and sharing your expertise. And of course, arthritis is something that a lot of us deal with. I know my grandmother had it. My mom is starting to have it. And so I'm thinking that I may be a candidate for it as well. How does it actually start? What are the symptoms?
Well, arthritis is a group of over 100 different disorders. Arthritis means actually pain and swelling to the joints. Okay. And joints are anywhere where two bones come together and there's a gristle or cartilage in between them and the surrounding tissues which can become inflamed. Mm-hmm. A lot of the arthritic conditions are hereditary. I mean, some are more pronounced than others as far as genetic tendencies. Rheumatoid arthritis and osteoarthritis, the two most common types of arthritis, are associated with a family history of arthritis.
And so what do you say to your patients that come in? What are some ways that maybe they can ease some of the pain?
Well, there's many. As a rheumatologist, we have a whole armamentarium of treating arthritis. We have very exciting treatments of rheumatoid arthritis these days. When I started my practice back in the 80s, we had very limited number of medications. A lot of the medications had a lot of side effects, and most people couldn't stay on them. But since the late 90s, we have newer drugs that actually can halt progression of the disease.
Awesome.
And some of these drugs are called the biologic drugs. For example, Remicade is an IV drug, Enbrel, Humira. These are drugs that actually will target the immune system to slow the destruction.
Okay. And of course, we did say that, it usually happens as you grow older, but it also can be someone relatively young that can get arthritis, correct?
I mean, there's, as children can get it as old as 2 years old. I mean, there's juvenile rheumatoid, there's all the various autoimmune diseases that we treat. Children can get it, such as lupus, conditions of the muscles called dermatomyositis.
Things like that. Okay. Now, as far as people that come in your clinic, or your center, what are some of the things that kind of help you to stand apart?
Well, as part of the I'm part of the diagnostic group, and we, Dr. Affine, the director, established this arthritis care center. He gave me the authority to be the supervisor of it. Part of the clinic, we have an IV infusion center where we can administer these biologic drugs, which are drugs that are very good and that can slow progression and maintain function and allow people to carry on their normal lives. A part of the center, we have MRI, where we can do extremity MRI of the shoulders and elbows and wrists and hands. And in particular with rheumatoid arthritis, it's nice to do MRI of the hands where we can assess early damage that we can't see on x-rays until months and even years after the development of symptoms. So. Also, we're starting to do clinical trials, which are investigational drugs, which give the opportunity to individuals who've exhausted the present treatment regimen, these new and potentially more exciting and better drugs. Also giving the opportunity for individuals who don't have the proper insurance or don't have insurance, where we can give them these drugs where they cannot normally get. And we also have a bone density. We do which does both assesses the lumbar spine and hips, and lateral views where we can assess fractures and really determine more aggressive treatment for osteoporosis.
And last question, for people that come in, should they have the symptoms first, or is it something where preventative measures, maybe just go ahead, hey, I've turned 50, maybe I should just check to see if I'm a candidate?
Yeah, well, my philosophy is early diagnosis and treatment. If you have any symptoms that persist more than, say, 3 months, you should see at least your primary care. He can assess you, do appropriate blood work, and refer to a specialist. But any symptoms that persist more than a number of months, as far as pain or stiffness to joints, should be assessed.
All right. Well, thank you, Dr. Les Goodman with the Arthritis Center. All right. Well, coming up after the break, Dana's going to have a check of the forecast. We'll be right back.